Right now, more than 36,000 nurses, midwives and healthcare assistants are preparing to walk off the job in a bid for safer staffing levels and better pay. Dame Helen Stokes-Lampard is the National Chief Officer of Health at Health New Zealand, and the Chief Medical Officer, I should say, at Health New Zealand, and joins me now. Good morning.
Good morning, kia ora.
Do we have safe staffing levels in hospitals right now?
Well, today's priority is absolutely about keeping people safe through the industrial action and wanting people to know what it's going to be like out there. With our nursing colleagues off taking strike action, as those who choose to, it means that we will be very short-staffed today. But I want to reassure people that emergency care will continue to be provided. Any appointments that have been cancelled or postponed will be rescheduled in the next couple of weeks. And if you have got an appointment today and you haven't had a cancellation notice, please do turn up. If you're unwell today and want to know what to do for the best, think, how sick am I? Is this truly an emergency? In which case you show up in whatever way you need to right now. We will do our best to look after you. You will get the emergency care you need. But if you're not sure, think you could phone Healthline first. That's 0800 611 116 to check it out with somebody on the phone, or contact your GP surgery, although our GP surgeries are under a lot of pressure also because community nurses may be taking action today. So keeping everybody safe is today's absolute priority because our hospitals are under a lot of pressure because we're in the middle of winter, there's been a lot of bad weather, and we've got a lot of staff sickness contributing. So it's a tricky time.
Yeah, really tricky time. And obviously, as you say, lots of patients are going to be affected today, lots of us. So the question again, do we have in hospitals in New Zealand safe nursing staffing levels? Because the union says we don't, and this is why they're striking. Do we have safe levels or not?
So Health New Zealand is absolutely committed to providing safe levels of staffing throughout all our hospitals and our community settings.
I know you're committed. Sorry.
And certainly some of our nursing colleagues feel differently, and that's why they're taking industrial action. But we're
what do
looking
you
at
feel?
Staffing in the
What
round.
do you feel?
So what I feel is that we are moving to, we've taken on thousands of more nurses in the last 3 years anyway. But we're looking at skill mix. We're looking at using different healthcare professionals in more creative ways, providing care via different pathways and upskilling. So that's using our allied healthcare professionals better. That's using a range of skills in nurses and our doctors in different ways. So things are evolving in healthcare and we all need to do this together. We need to collaborate. And I'd urge the unions back to the bargaining to resolve these outstanding issues, because the one thing I do know is that everyone is committed to safely staffing our hospitals as well as our community settings.
So just to be really clear, we don't have safe staffing, nursing staffing levels in our hospitals. So they are right on that point. The other issue they've got, they're not keeping pace with inflation when it comes to pay. Are executives at Health New Zealand getting inflation adjustments to their salaries? Is it not fair that we do the same for our nurses?
The actual bargaining details are with a different team, but I do know that the team that are providing the offers on the table believe they are very, very fair and very equitable across all parts of the organisation, and that we're trying very clearly to treat everyone the same because we are in a fiscally constrained time. We're trying to provide the best care, the best resource to everybody, and a lot of bargaining is going on simultaneously. But let's be clear, what we all need to do is provide the best care within the environment that we've got. And to do that, we have to be talking, we have to be collaborating and bargaining. So please, let's all get back to the table, resolve these outstanding issues together. The whole world is facing challenges with staffing. The whole world is facing challenges with resourcing healthcare post-pandemic. And that's tricky for us all to negotiate, but together we have to do it. I'm a frontline clinician myself. I see patients as a GP. We're all feeling the pinch, but together we can do this. And today's priority is keeping people safe during this industrial action. So please, from 9 o'clock, the strike begins. Things are going to feel different today.
All right, and it lasts for 24 hours. Dame Helen Stokes-Lampard is with us from Health New Zealand. She's the National Chief Medical Officer.